There's a lot of overhead in the healthcare system where patients go into emergency rooms or they wait in line at a physician's office, make appointments, and lose time at work in order to get a treatment for something that's relatively simple. John, at Accura, you've been building a platform and an associated app that really takes a lot of the costs and time out of the system, driving productivity gains for the enterprise customer. How does the platform work?
It's interesting because about 50% of what you see your doctor for, they never lay a hand on you, so you could see them virtually, and those are some of the issues that we're dealing with. When you think about how you deal and interact with your physician, really it's the same way you interacted with them 40 or 50 years ago. You phone their office, you try to make an appointment, and you get there the next day, the day after, or the week after that, and you check in and you wait in their waiting room. There is a lot of inefficiency in the system, and probably an easier way from a health outcomes and a client service standpoint to do this. And then beyond that, there's 4 million Canadians that actually don't have a family physician at all. And last year, 40,000 Canadians went to the emergency room just to get a prescription renewed. All these costs, ironically, are borne by employers. Employers are the ones that have to deal with short-term disability, an average of 9 lost days of work for health-related reasons every year. They're the ones that bear the cost. They're the ones that are using Accura for their employees, so their employees have access to virtual care.
The healthcare system, particularly in Canada, the single-payer system, must also like what Accura is doing. What is your relationship with government? Is there a basis to build a relationship with government?
Yeah, I think there's an opportunity here to save material system-wide costs. Not only through the triaging process, where we actually figure out what issues physicians should actually be seeing and not seeing, but also, when you think about it, post-surgery, there are issues and complications that happen, and people get readmitted when, in fact, some of those issues could have been dealt with virtually through a simple prescription or any kind of some lab work being done. So there are some system-wide costs that are very, very significant.
So a secure voice connection, a secure video connection from the app, texting back and forth. I get certainly how that could really bring a lot of simplification and efficiency, but how does the patient get comfortable this is going to actually improve the outcome?
The moment of truth in our practice is really when someone uses the app. They hit the initial big green button that says start a consultation, and they start interacting with a clinician either through text or then through image transfer, and as you mentioned, secure video. And then they might need a prescription, which we can send directly to their pharmacy, and then they get the prescription filled, or we can have it delivered. They might need lab work done. They might need a specialist referral. Once that consultation is done, that's typically when we hear back from patients and they say, I can't believe that worked. That's unbelievable that you just saved me the 4 hours. And we have now done tens of thousands of consultations and have solved 85% of them with no in-person contact. So it's remarkable what you can actually solve virtually for patients.
And that's 85% is a phenomenal statistic. Is the outcome for the patients comparable to what they would have had in terms of a physical visit?
Yes, it is. And not only that, there's a feedback mechanism that we have in place that most physician offices don't. So, I mean, patients score us after every interaction. And cumulatively over tens of thousands of interactions, we've got a 4.9 out of 5.0 score at this point. So there's a real two-way communication process between patients and our practice, really, that helps us improve on an ongoing basis.
What's your roadmap getting out of Canada and expanding globally?
Well, we think the Canadian market is actually a very meaningful one in size and could actually be somewhere in the neighborhood of about $5 billion total market size. So Canada is our first priority, and we're working with employers, and we've now launched this to thousands of employers and have about 100,000 members on our platform. So, Canada is sort of our first priority, and then we see an international launch and rollout really in the SaaS, in the software as a service market, primarily through our partners as providers in other countries, non-US mostly, will be using our platform.